And I think the speed, this is something that I hear a lot from practices. I can do it faster, especially your seasoned opticians, and that they can do no wrong in their own eyes, at least. And so it's easier, it's faster for me to just whip out my Sharpie, and I'm going to dot the eye or the lens up. So is it truly easier and faster to take measurements manually versus the Optikam?
It is. So on average, our accounts report that the entire measurement process from start to finish takes about 60 seconds. So when you consider all the benefits of the Optikam, but the fact that it's not just measuring PDs and heights, you're also capturing position aware measurements and potentially frame measurements, all with that single picture. And then you consider the integration that we have with most of the EHR softwares, it's undoubtedly quicker than the manual measurement process. We also, with the newest advancements in our app, when it's paired with some of the newer iPad models, we have the ability of taking measurements without attaching the device. So we have a lot of our accounts that use that feature specifically on standard lenses where it's just PDs and heights that are required. And that's quite literally the patient putting on the frame, lifting up the iPad, and taking a picture. So again, just as quick, if not quicker, than using a pupillometer to measure PDs only.
As somebody who's used the system in practice, even putting on the device on the frame is it's not like this is adding years onto taking these measurements. I mean, we should be talking to our patients and building those relationships anyway. And so we're doing this. It takes seconds to add the apparatus and then put it on the patient's face.
Right. And if you're truly comparing apples to apples and you're considering position aware, um, there's, I don't know personally very many opticians that could identify a dystometer, very less use one. So when you consider not just, again, PDs and heights, but all the position aware that you're taking with one single frontal picture, there's no question. And even if you compare it to some of the other technology that's out there, again, it required a lot of the competing devices are going to require multiple pictures or going to require input from the user to place these different markers, where that's all automated with our software.